Today, I'm Fiam Lara and I'll be performing the albumin test using the acetic acid method. First procedure is greet the client and introduce the self. Greeting the client to establish rapport, introducing the self para po malaman ni client kung ano ang name ko and also to start a better conversation. So, magandang araw po, Ma'am Ann. Andito po ulit ako sa bahay nyo. Ako nga po pala si student nurse Fiam and ako po ay taga Manila Central University. Next is explain the procedure with its rationale para po malaman ni client kung ano po ang ginagawa ko sa kanila and ano po yung procedure na gagawin ko as well as on how she can participate during the procedure and also to reduce her anxiety. So, ma'am, ngayon po, i-check ko ulit yung ihi nyo. Ngayon po to ko naman po sa protina na makikita sa ihi nyo. Titignan po natin kung nag-high blood po kayo or hypertension. So, okay na po ba sa inyo yun? And then next is gather all the materials needed. Gathering all the materials to continuously and properly perform the test or procedure.
Urine in early morning, acetic acid, alcohol lamp, match, 3 cotton balls with alcohol, kidney basin, 2 droppers, test tube holder.
And then next is instruct the client to urinate and then gather the specimen using a clean container. So, as instructing the client to urinate to gather specimen for the test, then placing it in a clean container para po ma-prevent na makontaminate yung urine or yung specimen. So, ma'am, for the test, kailangan ko lang po ng ihi nyo. Okay na po ba na umihi po kayo dito? Okay po. So, assuming that the client already urinated. Next is place the paper lining in a flat, clean surface or table. It should be clean side out. The purpose of this is to prevent the bag from getting contaminated. And then next is place the plastic lining over the paper lining and then it should be clean side in so the both clean sides are in contact. And then the purpose of this plastic lining is to prevent the bag from getting contaminated. And then next is place the bag away from the client and then tuck the handles. The purpose of this is to prevent the bag again from getting contaminated as well as the client. And then to prevent any further transmission of microorganism. And then tucking the handles para po ma-prevent na makasagabal yung handles sa paglabas ng mga materials later. Next is take out the apron, soap in dish, and then the towel. The purpose of this is for the hand washing. So, una po silang ilalabas kasi po yun po yung unang gagamitin and makakakontaminate po yung other materials if lahat po is ilalabas. So, here's the apron, the towel, and the soap in dish. Next is do thorough hand wash and then dry the hands. The purpose of this is to prevent any further transmission of microorganisms as well as to protect the client. Next is place the soaping dish and then the towel near the bag. Para po organized and hindi makasagabal while doing the other procedures. And then I will also wear gloves to prevent my hands from getting contaminated. Next is put on the apron and then it should be right side out. The purpose of this apron is to protect my uniform from getting soiled and contaminated. Next is take out the kidney basin and then 3 cotton balls with alcohol. So placing the 3 cotton balls in the kidney basin because it is sterile and it should not be contaminated. So my cotton balls already have alcohol. And then I will place 3 cotton balls. 1, 2, and 3. Next is take out the test tube holder, then 2 droppers, and then place it in the kidney basin. So they are sterile and clean materials, so it should be placed with other sterile and clean materials. Kaya kailangan po na nasa kidney basin and it should not be contaminated. So the 2 droppers, test tube, and then the test tube holder. Next is take out the lamp, the match, and then the 10% acetic acid. And then place it in the work area. It should be separated because it contains liquid or solution. Next is take out the waste receptacle and then place it outside the linings or away from the clean area. Because the waste receptacle, it will contain soiled and contaminated materials, so it should be separated. Next is light the lamp to get ready for the test. So with the use of test tube, place 2/3 of urine. And then I will place this dropper near the waste receptacle because it is already contaminated. Next is with the use of test tube holder. Put the top portion of the test tube in the flame until it reaches its boiling point. And then the mouth should be away from the client and also to the nurse to prevent any further accidents. The flame should be on the top of the test tube because the albumin is, it will float. So the urine reaches its boiling point. So next is place 5 drops of acetic acid, one at a time. And then put in flame again the specimen. So it should be one at a time para po ma-observe if there's any reaction. And then I will place this dropper near the waste receptacle because it's already contaminated. And then heat again to gather any reaction towards the solution as well as to the urine. So it already boiled. So next is interpret the specimen to gather or to finalize the findings about the specimen or to the urine. So for the interpretation, if it is no turbidity, it's negative. It is faint turbidity, it's positive 1. It is heavy turbidity, it's positive 2. And the solid turbidity is positive 3. So my specimen is there's no any progress or there's no any changes. So it means it's negative. Next is place the droppers near the waste receptacle. So I already placed my droppers because it is already contaminated and it should be away from the clean materials. And then next is put off the flame to prevent any further accidents. Next is wash and drain the test tube holder, then the droppers, and then place it in the work area. So, cleaning them to para po ma-keep na clean yung mga materials and ready for the next other treatment, and also to prevent further infection towards the other client. So I already washed and drained the materials. Next is disinfect the materials or clean materials using the 2 cotton balls, and then place it in the kidney basin. So I'll now first disinfect the kidney basin. So disinfecting the materials to keep the sterility and cleanliness of these materials and prevent any further infections towards other client. And then placing these materials in the kidney basin because it's already clean and sterile, so bawal na po sila makontaminate. So kailangan po sama-sama sila sa kidney basin. Next is with the use of 1 cotton ball with alcohol left, disinfect the lamp and then the plastic lining. The purpose of this is to keep the lamp clean and then sterile as well as the plastic lining. I will also disinfect these materials. Next is discard the cottons because it is already contaminated. And then next is discard or dispose the waste receptacle because it already contains soiled and contaminated materials. So it should be discard or disposed properly and immediately. I will also discard these gloves because it's already contaminated. Next is do thorough hand wash and then dry the hands. The purpose of this is to protect myself and also to the client to prevent any further transmission of microorganisms because my hands is already soiled and contaminated. Next is return all the materials used to their proper places para po organize ulit yung bag and ready for the next other treatment. And also, madaling kunin for the next other treatment po. Next is remove the apron away from the body and then it should be contaminated side in and then place it between the flaps of the bag. So, away from the body para po ma-prevent na mag-transmit ulit yung microorganisms sa uniform ko or sa katawan ko. And then it should be contaminated side in because para po yung clean side na lang po yung magiging in contact sa clean material sa loob ng bag pag binalik ko na po yung apron. And then placing it over the flaps of my bag para po madaling ulit kunin for the next other treatment. Next is fold the plastic lining and then it should be contaminated side in and then place it over the flaps of the bag. So it should be contaminated side in, same with the apron. So, yung in contact na lang po sa clean material sa loob ng bag is yung clean side ng plastic lining. So, I will now hold my bag to easily fold the plastic lining. Placing it between the flaps of my bag or over the flaps of my bag to easily para po madali ulit kunin yung plastic lining for the next other treatment. Next is hold the bag and then fold the paper lining and then discard and also it should be contaminated side in. So, kailangan po na hold yung bag to easily fold the paper lining and then contaminated side in because yung ilalim po ng paper lining is already contaminated and ang hawakan ko po is yung clean side. And then discarding the paper lining because it is the most contaminated material, so it should be discarded properly and immediately. Next is close and then lock the bag para po hindi mahulog or mawala na yung mga gamit and also para hindi na po makontaminate. Next is take the record, have a talk with the client, and then write down all the data that had been gathered, observed, as well as the treatment rendered, and then instruct the client about the care in the absence of the nurse. So, taking the record and then writing down all the data to have a reference for the next visit, having a talk with the client, and then instructing her para po malaman ni client kung ano po ang naging result ng test, and also malaman ni client kung ano po ang dapat na gawin niya. So, ma'am, tapos na po ako mag-check ng urine nyo or yung ihi nyo po. Ang lumabas po is no turbidity, it means wala naman pong nakitang protein or albumin sa ihi nyo po. It means it is normal and negative. So, ang dapat nyo lang pong gawin is have a healthy lifestyle po. Next is make an appointment, either it is clinical or home visit, and then take note the date and time. So, the purpose of this is for the follow-up care of the client. So, ma'am, next time po or next week, babalik po ako dito para po tignan po yung health nyo or kung may any progress po. So, okay na po ba sa inyo yun? Okay po. So, next week, November 29, it is Monday, and babalik po ako ng mga bandang 10 to 11 a.m. So, that's all for the albumin test using the acetic acid method.